Welcome back. February is National Heart Awareness Month, and here is Dr. Michael Black from Palm Beach Children's Hospital on how you can be more aware of congenital heart disease. Dr. Black, my friend, it is good to see you again. How are you?
Wonderful to see you again, Dave.
And it's good to see that you're in your scrubs in case something goes wrong during the next 8 minutes.
I'm ready and able.
We're in good hands.
Yeah, we're in good hands.
February is Heart Awareness Month.
Yes.
And February 14th was, what, Congenital Heart Awareness Day or something?
Yes, and Valentine's Day.
And Valentine's Day, right. So let's talk about congenital heart defects. And the first question is, cases of congenital heart defects, do they often go undiagnosed? How many go undiagnosed?
There's different stages in making the diagnosis of children and adults born with heart disease. Whether you're lucky or not, you may get the diagnosis when a mother is pregnant. The mother may just go for a routine ultrasound, and as part of the routine ultrasound, they recognize there's a heart defect. It may be somebody who's 88 years of age. I had an 88-year young patient who complained of symptoms, and unbeknownst to her, she was born with heart disease, and it was just not recognized for a long time.
Medically, how do you, so someone comes in and they're 88, how do you know that they were born with heart disease?
Fortunately, she came with a little title on her telling me what the diagnosis was.
Oh.
But typically they have symptoms. And as you get older, you can have other problems, non-cardiac problems, but usually fatigue during exercise, just feeling tired more than usual, having your heart have extra beats, palpitations, shortness of breath, or just swelling of the ankles. I mean, those are signs that your heart probably is not working as well as it could.
But again, when you talk about kids, kids aren't going to be able to be as verbal with symptoms.
Correct.
Right?
So with babies, it's different. Most of the time we talk about heart failure, people imagine their grandparents who've had heart attacks. In children with heart failure, it's high output failure, not low output. So it's like being on a treadmill. So the baby actually sweats. Even when they're resting, that you have to change your pajamas, they may be breathing very fast, their heart rate may be very fast. They may not be putting on weight. That's the most typical symptom, is that other than being blue, you would recognize. But a symptom that you don't recognize would be, mom's concerned. The baby is just not meeting the standards when they see the pediatrician, or falling off the curves, or you're feeding them, the kid's eating, but they're just not putting on weight.
They don't do any sort of advanced preventative tests on healthy kids regarding they don't do EKGs and stuff like that on kids.
That's a great question. So there's this whole cohort of patients. What do you do with athletic people in high school? They want to try out for football or cheerleading practice or whatever. So parents are nervous, and most of the schools really want to find out who potentially has this unknown hidden disease. So EKGs, there was some push a few years ago out of Europe that if you did EKGs on everyone, you would catch a certain amount of patients with disease. They're very soft. They're not really diagnostic tests. An ultrasound of the heart is very, very good, but most doctors won't go to that investigation as the first step. Mm-hmm. So again, you always listen to your patients. Rarely do they present with a sudden death event, which is everyone's fear. And usually that's for either too much muscle in the heart, usually a strong family history, uncles and aunts passing away in their 30s, 20s, 40s, something unusual, or some coronary problem, again, sudden death event.
So, I guess it is kind of good news that very rarely, it would seem, someone's going to die sort of right away from a heart problem.
Correct. So either they present, it's like bimodal. They present when they're born, they're blue, they have symptoms, an ultrasound is made, they're either found prenatally, they're found as a little kid, and you watch them, and then you determine if you need to do an intervention, surgery, or catheter-based. Or they present later in life and it's missed, and hopefully if it's missed, it's not a life-threatening event, it just needs some work. And
we have cardiologists in from time to time, and the technology is amazing for valve replacements or whatever it is. So I would guess if you can just be healthy sort of and live with it for as long as you can, that maybe by the time 30, 40 years from now you need something, technology is going to be amazing.
Yes, you'll be a cyborg, half computer, half mechanical. But no, you're right. I think the big push is to do everything minimally invasive and then catheter-based. And the technology is getting good enough, the metallurgy, to put things in the body without opening the chest or opening the heart. And the imaging is getting really interesting. So I would say over the last 5 years, the imaging, they have now what's called four-dimensional imaging. So you have time as another dimension. So you can see actually blood flow. And they have 3D printing. So if you have an abnormality in your heart, you can actually print out the abnormal heart as a model and work on it before you even touch the patient. So it's very cool stuff.
Oh, that is really cool.
Yeah.
Can you do that next time? Can you just bring in an abnormal model of a heart and just do a surgery for us?
Sure, if you would like. Yeah.
Sure. Can I assist?
Absolutely.
Scrub in?
You may find you're an amazing surgeon. Maybe you'll change professions.
I was never good at operation at the game, but I'm happy to
That's
try.
actually a bad sign. If you get the nose to light up red, it's always bad.
Yeah, is that like the first, when you go to medical school, that's day one? Yeah.
Yes.
If the nose lights up red, pick another career. Yeah. So what do you do? All right, so a patient comes in and they present, whatever it is, but it's not life-threatening. What's the typical course of action for a child or a young adult monitoring? Is it like every year go to the cardiologist? What do you do?
Depending on how old and what the condition is, it varies. It's just the whole spectrum. So if they're born with a hole in their heart, let's say 60% of them close. If it's in ventricular septum in the bottom chamber, they'll get ultrasounds. The doctor will listen to them and hear the murmurs. You ask about symptoms. Some other conditions need an operation in the first week of life. So it just really depends on how complex it is. But if we can wait, we usually try to wait till the baby's a little bit bigger and can tolerate us mucking with them or doing operations with them.
The sort of obvious question is like, how can people stay heart healthy and, don't drink alcohol or smoke cigarettes? In addition to sort of obvious ones that everybody knows, any other tips that you can give people, maybe more subtle tips on how they can keep their heart in good shape?
Absolutely. Everything in moderation. There is some definite direct evidence that red wine is healthy for men. So the studies show men's red wine, not white. There's some really good evidence now about the amount of fat in your diet. It just came out this week. It's very interesting. Everyone's worried. Now they go, maybe we can eat more eggs. Maybe we can have less fat.
I just heard that,
it's
yeah.
Very interesting. So yeah. I've always believed that too. So when you eat sugar, your liver converts the sugar into bad fats. So carbohydrates probably are not good. Refined sugar, which has been in our diet for about 150 years, right? That is a real problem. Having fat is not such a problem depending on which fat. So an egg is a chicken. Chickens in an egg, it can't be that bad. It's very good cholesterol. So, and they found some other things that are very interesting, like why do French citizens who eat cheese and drink wine don't have the same incidence or prevalence of heart disease? And we find that cows that eat grazing on grass, naturally fed, their milk and their cheese have certain protective items in it for human beings. If you eat corn-fed cheese, that's from America, then you may have a problem. So we're learning a little bit more about the environment. So great advice would be to exercise. I think it's great. Watch your weight. Try to monitor your diet. If you eat a lot of refined sugar, bread, and whatever, that's probably a bad thing. But certain cheeses are very good for you and very heart protective, and everything in moderation. It's okay to have fat.
Yeah, everything in moderation.
Everything in moderation.
Always good to see you.
Wonderful to see you too.
Yeah, people want to reach you, book an appointment, come see you. How can they find you?
They can call me in my office, 561-227-9240. Or they can actually call you and you can give them my number. I'll give it to you.
Just call me. Yeah. Everyone has. I give all the viewers my cell phone.
I think that's fantastic.
Yeah, and my address.
Yes, that's why there's lines of people outside.
Right, paparazzi. Yeah, Dr. Black, a pleasure, buddy.
Great
see
day.
You soon.
Wonderful to see you. Thank you.